Have you ever chased knee or groin pain with stretches, braces, or pills, only to find nothing changes because the real problem is hiding in your hip?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining how hip issues can masquerade as knee, thigh, or groin pain, why that confusion delays treatment, and what steps you can take to identify the true source.
I'm Alara Sky. This matters because many people don't realize that your brain can misread pain signals that travel along shared nerve pathways. Hip problems frequently project pain into your knee, groin, or thigh, and that misdirection can send you down the wrong treatment path for months.
A recent national survey from the Ohio State University Wexner Medical Center highlighted the scope of the confusion. 72% of respondents didn't know knee pain could signal a hip issue. 69% overlooked groin pain, and 66% missed thigh pain as a potential hip clue. Many also ignored lower back pain, night pain, and sleep trouble as indicators. And a large share tried to push through symptoms or relied on over-the-counter drugs instead of seeking a diagnosis.
Those numbers show why you need a precise evaluation. As orthopedic surgeon Dr. Matthew Beal explains, a patient might arrive for knee pain, but when the hip is rotated during an exam, the pain fires right there, and imaging may reveal hip arthritis that actually explains the symptoms. When your knee therapy fails repeatedly, it's time to ask whether your hip is the real origin.
Referred pain is the key concept. Because your hip, lower back, groin, buttock, thigh, and knee share nerve connections to the same spinal segments, your brain sometimes projects pain to the most familiar area instead of the true source. With hip osteoarthritis, common signs of referred pain include a limp or gait change, groin discomfort, pain that worsens at night or after prolonged sitting, an ache that radiates toward the thigh or knee.
Getting the diagnosis right includes careful history and physical exam, supported by X-rays or MRI when needed. Some clinicians use diagnostic injections. If numbing the hip relieves both the hip and the distant pain, that confirms the origin and helps you avoid unnecessary procedures on the wrong joint. From there, options range from targeted physical therapy to platelet-rich plasma injections. Anti-inflammatory drugs can blunt symptoms, but they don't solve the root problem and may bring side effects.
Hip-related pain isn't the only explanation for knee and groin symptoms. Overuse or injury to the iliopsoas, the main hip flexor, can create pain from the groin down toward the knee. That often follows weight training, running, or sports, and typically improves with rest and physical therapy over 2 to 6 weeks when handled promptly.
Hip osteoarthritis is another major driver. Adults over 50 are most familiar with it, but younger people with conditions like rheumatoid arthritis, psoriatic arthritis, or lupus can also develop hip degeneration. Corticosteroid injections are commonly offered, but research shows no significant long-term benefit over placebo, and repeated injections can worsen joint damage, which is why many people consider physical therapy and PRP as safer options.
Other structural issues include hip impingement, where extra bone causes abnormal contact, and labral tears. The ring of cartilage that cushions and stabilizes your hip socket can fray or detach. Arthroscopic repair for labral tears reports success rates in the 70% to 90% range with improved function and pain relief, often as outpatient procedures.
Nerve compression may also mimic joint pain. Pinching of the femoral or sciatic nerve, whether from a herniated disc, arthritis, or general spine wear, can send pain from the back or pelvis into the groin and knee. Short-term steroid shots sometimes reduce inflammation. In more severe cases, procedures like fusion or artificial disc replacement may be discussed after conservative care is exhausted.
Pregnancy adds a unique layer. Rising relaxin levels and added weight can shift your center of gravity and compress the sciatic nerve. One survey found 22.1% of women in the third trimester experience sciatica. Gentle stretching, yoga, and lower back and hamstring exercises are recommended. And if pain persists beyond 4 to 6 weeks, you should consult your clinician. starting with your OBGYN when pregnant.
Another overlooked piece is bone health in younger adults. Sedentary living, nutrient-poor diets, poor sleep, and chronic stress push bone density down and joint wear up, showing early osteoarthritis signs even in your 20s and 30s. Lack of weight-bearing activity weakens bones further. Screening for bone density and joint health identifies problems earlier, and techniques like weight-bearing movements, blood flow restriction training, and vibration therapy are recommended to strengthen your foundation.
When it comes to pain management, a combined strategy works better than chasing symptoms. Physical therapy to correct posture and movement patterns restores balance, reduces inflammation, and improves joint mechanics. That approach can be paired with options like PRP when indicated, while recognizing that routine anti-inflammatories don't fix the underlying cause.
You also have complementary tools. Certain herbs, such as willow bark, ginger, turmeric, rose hips, devil's claw, boswellia, feverfew, ashwagandha, black cohosh, corydalis, rosemary, and thunder god vine, are discussed for inflammation and pain modulation. Some herbs interact with medications and may be unsuitable during pregnancy or breastfeeding, so you should seek guidance before use.
Nutrients play a supportive role: magnesium for muscle and nerve function, vitamin D for bone health and immune regulation, and choline as a precursor to acetylcholine involved in pain modulation. Stress reduction practices matter as well: mindfulness, breathing exercises, yoga or tai chi, visualization or guided imagery, and tools like biofeedback and cognitive behavioral therapy help lower tension and improve pain control. Aromatherapy, including orange essential oil, has been noted for easing pain and anxiety.
If you want practical steps now, consider exercise therapy aimed at hip stability and mobility. Examples include hip extension holds while standing, side leg snow angel patterns on your back, glute bridges for pelvic stability, side-lying hip adduction for inner thigh strength, heel slides for controlled knee and hip flexion, and standing hamstring curls. 8 to 10 controlled repetitions per side is a common starting target, adjusting with a therapist if any move aggravates symptoms.
Let's bring this home with clear decision points. If your knee or groin pain lasts more than 4 to 6 weeks, worsens with activity, or disrupts walking or sleep, schedule an evaluation and ask directly whether your hip could be the origin. If you have recurring knee pain that never responds to treatment, request imaging or a diagnostic injection and strategy that considers the hip before escalating interventions.
Here's today's challenge. Over the next 7 days, track when your knee, thigh, or groin pain appears during sitting, after walking, or at night, and note any limp, shoe-tying difficulty, or pain when crossing legs. Bring that log to an appointment and ask for a hip-focused assessment, including imaging if appropriate, and a physical therapy plan that addresses posture, strength, and movement patterns.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.